Welcome to Caring for Patients with Down Syndrome, a professional development series for health providers, brought to you by the Down Syndrome Association of Greater St. Louis and the Global Down Syndrome Foundation. This lesson, Enhancing Communication Through the Lens of Specialized Care, features Dr. Beau Ances.
Hi, my name is Beau Ances, and I'm a professor of neurology at Washington University in St. Louis. Today we'll be talking about the do's and don'ts when treating and talking to adults with Down syndrome. Some of the do's: first, make eye contact with the adult with Down syndrome. Do not just talk to the family members, but actually talk to the patient and have a real conversation with them. Other do's that you should be doing: find an area or common ground that you can talk with the patient about. Find those kinds of interests and things that they like to talk about. In addition, when approaching or talking to adults with Down syndrome, make sure that you explain things in a normal voice and do not use silly voices or use certain kinds of gestures or emotions or talk down to any of these patients. In particular, they like to understand and have the capacity to understand and know what you're talking about. When talking with adults with Down syndrome, also promote their independence and really get interested in their achievements. It is so wonderful to hear about so many different aspects that they are experts in it, and really make sure that you celebrate those special achievements that they've done. Don't think that they won't understand what you're saying to them. Don't treat them as if they're a child, but actually treat them as an adult with capabilities to understand what you're talking about. Also, respect their choices and understand that they may have different ideas or approaches to a particular topic, and you should celebrate their choices, not make the decisions for them. Allow them to make their own decisions and come up with a plan with you. Support them in their choice to participate in their care, and if they want to, even in research studies. Make sure that their voice is heard and ask them questions to make sure that they understand and that they want to participate in certain aspects of their care. When seeing an adult with Down syndrome, you must take into context what are the changes and how are those changes compared to their baseline. So when I talk with families and I ask them how their loved one is doing with Down syndrome, the first question I'm asking is this different from what they were in the past? If it is different, this is not just due to Down syndrome. There may be some underlying cause that may be present. And it may be different at different ages. So at younger ages, in their 20s or early 30s, and we see kinds of changes where they become a little bit more reserved, where they're not interacting with as many people. It takes them longer to do certain kinds of activities. Then I am concerned that this is not just due to regular Down syndrome, that actually a neurological disease like regression could be occurring. In contrast, in individuals that are older, in their 40s and especially into their 50s, and they're starting to have thinking issues, this is not typically seen in run-of-the-mill Down syndrome. And in particular, what we think may be occurring is that these individuals may be having the first signs of Alzheimer's disease. And so talking with the families, understanding what the baseline of that individual and how it is or is not changing, and then coming up with a further workup can be very important. We should never be just saying that this is solely due to Down syndrome, but are there other reasons why that this loved one is having these changes.